and welcome to Incorruptible Mass. Our mission here is to help us all transform state politics because we know that we could have a legislature that truly supports the needs of the 7 million of us who live here. And that's what we're going for. So today we have an exciting conversation about universal health care here in Massachusetts. We have a fantastic guest, Gerald Friedman, who is going to help us talk about that. We will talk a lot about the history, including about the ACA and where it came from. We will talk about Trump's views on universal health care. We will talk about what has changed in the last 20 years since the ACA was passed. And the profit motive, of course, we're going to get into that because how can you not? And we'll talk a little bit about the politics of getting this passed here in Massachusetts. But before we do, I am going to have my illustrious co-hosts. I should come up with more adjectives. I'm always like illustrious, fantastic, and amazing. But I will have you guys introduce yourselves, starting with Jordan.
These are all great. I like all of them. Jordan Brooke Powers, he, him, and I have worked in I've worked in politics for many years now, in Massachusetts politics for many years now. And fun fact, when I was a legislative aide in Congress, I had healthcare as one of my portfolio issues.
Hmm. And Jonathan?
And before I start, Anna, to your point, there'd be funny for you to show up with like a big thesaurus on screen one time.
How
Even
about
funnier,
a fishbowl with like adjectives?
right? That would be fun. Jonathan Cohn, he and his, live in Boston in the South End, have been active in progressive issue and electoral campaigns for well over a decade now, here in Massachusetts, and always excited to be here.
And I am Anna Callahan, she, her, coming at you from Medford, where I am a city councilor. Done a lot of work in local politics across the country and state politics, fortunately, with these guys. My mom is British, and I just grew up my whole life with the understanding that like our system is totally dumb. Why on earth we would not have universal healthcare is like mind-boggling. So I'm always happy. Anytime we can talk about universal healthcare, I'm happy to talk about it. So on that note, I would love to introduce our very special guest, Gerald Friedman, who is also here with Mass Care, an organization doing universal healthcare here in Massachusetts. And Gerald, if you want to just give us a little bit of lowdown about like the bill that you guys have and what it does, and if it has changed for the last few terms, that would be fantastic, as well as anything about yourself and how you got into this.
Well, I'll start with the bill. And yes, Anna, it has not changed significantly. I've been working doing economic impact studies for MassCare since I believe 2007. It's in the midst of time right now. And every 2 years, I've updated it. This year, I passed the responsibility on to Auden, who did an excellent job. He's a really smart guy. But over that time, I've done these economic impact studies for, I don't know, like 15 states. I've done it for the United States a couple times. And the results are always very similar. There are variations, like in Massachusetts, we have a relatively low share of the population without any health insurance. So when we establish a universal program, extending coverage to those who are uninsured is a relatively small cost. In other states, it's a larger cost. But those are, fiddling around the edges. The big things are that we could lower the administrative waste in the healthcare system. We can lower the waste to people of spending so much on overpriced, monopolized pharmaceuticals and medical devices. And here's the thing that gets into trouble. The biggest single savings from a universal system would be by driving down the price paid for hospital services to elite hospitals like Mass General. And balance against those savings, which amount to like 40% of our healthcare spending in Massachusetts and similar in other places, Establishing universal coverage would cost more for covering the uninsured, and eliminating co-pays and deductibles so that you just walk into the doctor's office and get care. That people would use, go to the doctor more, which costs more. They would use the prescriptions. I've been told by doctors of patients who walk out of their office, look at the prescription form, and drop it in the wastebasket because they know they'll never be able to pay for it. So that would not happen. And that would cost money. We'd be filling prescriptions that people are not filling now. Balance against that, people would be healthier. Americans' life expectancy is like 4 years below the average for the OECD, 4 years below Canada. Even Massachusetts, which has just about the best healthcare system in the country, we have people who, more than a third of the population of Massachusetts report that they did not get healthcare at some point because of cost. If everybody had the healthcare they need, we'd have a healthier population. People would feel more comfortable emotionally, and people would be able to go to work more consistently. And if we did away with the employer-based system, people would be able to quit jobs that don't work for them and go someplace else or start out on their own. All of these things would make us a more prosperous as well as a happier country. If we could be more like Denmark, which does not need a U.S. hospital ship, that we couldn't even send them, then we'd be a more prosperous country as well as a happier one. So that's what the Mass Care Bill is all about. That's what the national efforts. Ideally, we would do this on the national level so that everybody would get the benefits in Mississippi, whatever. But I've been one for forever thinking that we should do it wherever we can. And if we can do it in Massachusetts, then let's go ahead. And if nothing else, we'll set a good example for everybody else.
Fantastic. Any commentary from my fellow?
I was thinking about, I was listening to Anand Giridharadas last night, and he said something that really hit me, which is that Americans struggle with things that no one else that other people take for granted. So France is a much poorer country than ours. Like, we don't take that for granted, but it's much significantly poorer than America. Most of these countries are much poorer than America, but their citizens don't worry about the things that we worry about. They because their government takes care of those things. And so we have stresses and we have things that poorer countries, places that have less money than we do, take care of their citizens so that they don't have to worry. Like, Belgians are not it's not a rich country. It's not a big country, but they can manage to care for their people in such a way that their people can retire without having to, there's these reports that Americans will need like $3 million to retire. Then most Americans don't have $50 in their bank accounts, I think is the median, right? Like, it's just, it's bizarre that we as a country and our elected officials, and nominally the party that's supposed to represent the majority of us, just thinks it's fine that corporations run roughshod over us, and most of us, and the government does not do basic things, even though we have so much money, like just way more money than other places.
Absolutely right. And we need to think about the healthcare system we have in this country is not about healthcare. It's about profit. Making profits. And healthcare is kind of an accidental byproduct of the for-profit system. So we give companies the chance to make a profit in the hope that they will seize that, produce healthcare as a way to advance their profit. The problem, of course, is there are a lot of ways to make profit in healthcare without providing care. The best way for an insurance company to increase its profit is to find the people who are going to be sick and get them out of the pool. You see this all the time with whenever the so-called medical loss ratio goes up for a private health insurance company, that the medical loss ratio is the proportion of premiums that go to paying for healthcare. That's a good thing. We want that to be a big number. We don't want to be spending a lot of money on insurance administration advertising, but whenever that ratio goes up, the stock price goes down. And maybe they'll bring in a new CEO who will work hard to drive down that ratio. Ideally, they would love it if the ratio was zero. If they could get all the money coming in as premiums and walk away with it as profits or advertising for the, but that's
Wouldn't
what
that be
the
nice for
system's
them?
about. They would love it. They would love it. Hospitals are a little different because they do want patients to come in. But even there, which patients do they want? They want the patients who will give them profit. They want the patients who come with good insurance. They want the patients who will give them a good outcome so they can advertise that. So that's what the system's about. And we've moved further in this direction since, it's not my fault, but since I first got involved.
Yeah, well,
totally. Thinking of the okay, one
in the 1970s.
Just kidding. The one thing that we were talking about before there that I think is such a fascinating thing, and this speaks to the issue of time, is realizing both, let's say, in Massachusetts, how far we are now from like the premier, let's say, healthcare reform bill, and how far we are from the Affordable Care Act, because we are Massachusetts's it's 2000. That we're 20 years past the big like healthcare reform law. I'm trying to find the exact date. The big healthcare reform bill known as Romney Care, even though I think it gives Romney false credit for things that he like tried to water down, and it's more like Sal Damasi Care, if you will. It's gonna be 20 years old this April. And then in a few years, the Affordable Care Act will become 20 years old. That's only a few years away as well, with that having been a very recent memory from the time that the Affordable Care Act was debated and ultimately signed in 2010. So if you think about like this year as well in 2026, that the Affordable Care Act will be old enough to drive a car if it were a person. Just like the Massachusetts healthcare reform bill, old enough to vote, and next year it can drink. Which it shouldn't do if it's.
I think it should.
Oh, come on! You need to drink, given the condition of our country.
Exactly. Given the condition of the healthcare system, next year the Massachusetts healthcare reform law might take up drinking, which it can legally then do. But I think that what's so interesting when thinking about both of those in terms of time is I feel like both of those have very strong holds over the political imagination in general policy landscape and healthcare. And I feel like that's in a way that wasn't the same, like didn't feel like it was the same case at the time that they were passed, that things 15, 20 years prior, like obviously all the stuff from the Clinton, kind of Bill and Hillary's attempt at putting together something in the early 90s lingered over the Affordable Care Act, but not in the same, obviously in part because it failed, but we were kind of stuck in a certain paradigm of healthcare that we'd been for so long, and would love kind of opine some about, as we're now like close to 2 decades past that, how timely it is then to actually start thinking about what the next phase of the U.S., kind of the evolution of healthcare in the U.S., especially as we then have like a presidential election coming up again in a few years, where that'll be big, as well as how increasingly broken it has become since then.
If you look at, there are two ways you could look at the success or failure of the ACA or Romney Care. The first is controlling costs. And that's been Jordan, you got it. It's been a complete failure since the Affordable Care Act was signed in 2010. Premiums for private health insurance have just about doubled.
More than doubled. More
in
than
15
doubled.
years.
They've
Yeah,
more than doubled.
yeah,
To be clear.
yeah. Okay.
212%. So more than doubled.
And let's
Yeah.
not forget that premiums are the things that's the money you fork over when you have literally gotten nothing,
Yes.
nothing out of it, nothing,
Yes.
not one thing.
Yes,
You'll not see a doctor.
the share of our national income that goes to healthcare has continued to increase.
Mm.
So that now we're close to, we're it's kind of leveling off between 17 and 18%. But the reason it hasn't increased even further, and this gets to the failure of Romneycare as well, is that we are more and more deferring needed health care.
I was about to say that.
This is showing up in our declining life expectancy. Life expectancy is one piece of this. I once, as I mentioned to you guys, debated Zeke Emanuel, and he said, "Oh, life expectancy, but you got to look at other things." Well, let's look at maternal mortality.
Mm-hmm.
Let's look at infant mortality.
Yeah.
Now, these are still very good numbers for people like me in Amherst, Massachusetts, tenured professors, but there are parts of this country where the numbers for maternal mortality and infant mortality, both of which nationwide are worse than almost any other advanced country in the world. For maternal mortality, I believe we're 44th in the world.
Wow.
But there are places.
But who cares about women? Those are women. They don't count.
Or babies. You would be better off giving birth in Lagos, Nigeria.
Oh my God, really?
Than in inner city, New York or Cleveland or Detroit.
I'm glad I went to a birth center.
It's just like by every metric, right? So I just want to like put it in real dollars for people. So if you had $100 when the ACA, if you spent $100 when the ACA was passed, if you try to spend that, the same dollars would be $200+, right? For healthcare. Yeah. If you just everything else, you're like, well, everything else got more expensive. It would actually only be it would be $300. Sorry, so it would be $300, and then everything else would be $150. So it's going 3 times the rate of increase for insurance is going 3 times as high. And the other thing that's happening at the same time is like it's not just that it's like astronomically getting more expensive just to get insurance. You also, like all of us know, right? What else has happened? It's covering less. It's requiring the plans are worse. Like, so also like the plans were better. They were covering more things. Your co-pays were less. The amount of money it took to like hit your deductible was less. So like not only like we're just talking the price out of your pocket, but
in
the
late
thing you're getting is worse.
The annual report by the Center for Medicare and Medicaid Statistics on employer-provided health plans did not ask about deductibles and did not ask about copays in the late 1990s. That question for deductibles was added, I believe, in 2001, copays in 2012, because what we've done with Romneycare and especially the ACA is we've accepted the premise that the problem with American healthcare is that it's too expensive because we use too much healthcare. There's a committee coming out in the Massachusetts legislature, yet another one of these committees. How can we control healthcare costs?
Boy,
in a report in the Commonwealth, forget the name of the
Commonwealth
Beacon. That's it. They talk about the things they're going to be looking at. How can we control costs by getting people to be more efficient so they don't use as much health care? And that's what the deductibles and copays have been about. The strategy of raising deductibles and copays is to get people to pay for the health care on the margin so that they won't do it. And it works. More and more people are opting out of getting health care. With one other result, that more and more people are looking for alternatives. And that's part of what's behind the MAHA movement. Like, let's not trust the doctors. Let's
Right.
just do it ourselves by drinking whole milk or whatever it is.
Raw
Because
milk.
that's what it forces you to do. It
Yeah.
forces you to say, to try to rationalize away how to do things that, like, and on top of that, like, if you think about from the doctor's perspective, because the system isn't putting just pressure on us, right? It's putting pressures on the doctors themselves. So they went
Yes.
from being able to spend on average 16 minutes per person in a
Mm-hmm.
meeting. Even before that, you're talking 30 minutes to now.
Yeah.
If they spend more than 6 minutes with you, some administrator is calling them up and yelling at them for spending more. Like, it's not like they don't want to spend time. It's that they get yelled at, saying,
Yeah.
we can't bill, like, we can't
Well,
afford it. We have to bill, we have to do these things. So
they've
you
been
get this
pro-
thing. So then if you're a regular person, just real quickly, if you're a regular person, well, your experience of the healthcare system is a doctor who rushes in, who doesn't know you, who doesn't really hit all the things, and because you've been waited to get care, probably isn't giving you all the care you need, and so now you're distrusting that system and you're looking for alternatives, right? So it's just
Exactly. Yes.
it's just a system in decline in
Yeah.
every possible way. Fewer people are going to become doctors. Doctors are leaving in droves. Like, everything about this system is in decline, and people are just trying to figure out how to, like, manage the decline in a way that we can save as many healthy white men as possible.
Yes. Yeah, really, you hit it on the nose, Jordan. Now, a part of this is also that the profession of medicine has become proletarianized. When I was a child back in antediluvian times, our doctor, a family doctor, had his own practice, made his own hours, made his own decisions. That is really uncommon nowadays.
Oh yeah.
Something like 15% of doctors run their own practices, and most of those are specialists. Family practice is almost entirely owned. Our doctor, and I've got to say, our family doctor, I'm with my wife and I see the same woman. It's wonderful. Love her. But she is owned by Mass General, as are a great many doctors. Now, Mass General will say, and they did this a few years ago, that we lose $70,000 on every doctor whose practice we purchase. Well, why are they doing it? I mean, this is just bullshit. They buy the doctors so they can steer patients away from other hospital systems towards their own.
Yep.
So that means, I mean, that may be fine. I've gone to Mass General and Dana-Farber. I'm very, very happy with the care that I've received, but it's not that it's right for me. It's not necessarily right for other people. So if you want to have many procedures in Western Massachusetts, you can't do it locally anymore. You have to go to Boston, where they charge more because they're an urban teaching hospital.
Yeah.
So they get higher rates from Medicare, and they get higher rates from the insurance companies.
I was going to jump in because you guys are talking about MAHA, and I think it's really important that we talk about Trump's opinion of universal health care. And Jordan, you read this aloud, and I was so excited.
Yeah.
Wait,
Jordan, read it again for the studio audience.
Don't tell people when it's from. Just quote it.
It's of Trump's 2000 book, The America We Deserve.
No, 2015. Didn't you say 2015?
Trump wrote, it was no, the book is from 2000.
Okay.
Sorry. He was when he was thinking about running for president. And the article came out in 2015, so that was my mistake. He said we should not hear
he was going to run on, like, the Ross Perot party line. That's wild. We should not hear so many stories of families ruined by healthcare expenses. I'm a conservative on most issues, but a liberal on one. We need as a nation to re-examine the single payer plan. That's what Trump wrote. And like many a times, if you've heard him talk, I have some other quotes of him basically back-ending into this place over and over again about, like, this system's really dumb. What are these insurance companies doing? They're ripping you off, right? He's literally currently, just recently this year, has made the case
that like, you know, like the reason that we should give, instead of giving money to insurance companies,
Yeah.
they should give it directly to us,
Yeah.
is because insurance companies are ripping you off. And I just keep thinking, like, you're almost there. Like you just don't understand that, like, none of us are gonna, like, if we get a $500 off our MRI that costs $8,000, that's not actually helping us. But like there is a system where we are paying health insurance companies to do literally nothing. There is that system out there, and you wrote about it. Like you just need to back into that place. But it is fun.
And those systems are very popular everywhere else in the world. I don't watch the Olympics, but in what was it, 2006, the London Olympics?
Yeah.
It opened with
London was 2012.
Oh, 2012.
2012.
Yeah.
Okay. It opened with a tribute to the National Health Service. You know, Britain's universal coverage system, which is also government run. In Canada, the national health system is enormously popular. The U.S. stands out as the one country in the Organization of Economic Cooperation and Development, the one country where people don't like their healthcare system. They like their doctors, they like their hospitals, but they don't like the healthcare finance system.
I just want to say too that, and Canada is the only country. So people always, you know, one of the things is Americans love to rag on Canada's system. Canada's system is the second worst. The only one worst is us.
Yes.
And people love it. Like, just to be clear, like, people in Canada love it. And it has, the only place that has worse healthcare is us. And they love it. That's much better their system is.
Well,
you can't find an American who loves our system.
Yes.
There's not one.
Oh, except the health insurance executives who average over $20 million a year in compensation.
Wait, and Jordan, do you not have like bumper stickers of like "I love my Blue Cross Blue Shield" or other? Like,
but I know, Jonathan, you kind of
Worcester.
Jonathan, you stepped on something though. Gerald, what's the average compensation for these health insurance?
A few years ago, I haven't checked it the last 2 or 3 years, but a few years ago, the top 7 health insurance companies, the average compensation for the CEO was $23 million. United Healthcare back then was $28 million. I doubt that it's gone down.
23 million, 28 million, and how much for security guards?
And it's like, but also
apparently not enough.
Apparently not enough.
The other piece to that is just to remember that that's our money that's actually meant to give us care. Like every single penny of that executive's pay is your money that was meant to go to make you better.
All goes into that medical loss ratio that they want to drive down so that there's more money for them. And mind you, the high compensation, it extends to the more worthy people running our hospitals. The heads at Mass General, the heads at Dana, and there's a certain amount that's spread around.
It's always
almost
shocking.
Like there's a class of people who all agree with each other.
It is shocking whenever you look at the hospitals and health insurance companies, particularly when some of like the ones like hospitals are largely not-for-profits that do not act like nonprofits.
It just means they don't pay taxes.
Exactly. It means they don't pay taxes and they don't have investors.
Yeah.
They don't have to pay anybody dividends and they don't have to pay anybody taxes. And that even when you have some of the like certain health insurance companies too are technically like not for profit, but like they don't act like that either. Yeah. And it's always kind of shocking like how much market logic just exists across the system regardless of tax status.
And all this was intentional. This was policy going back to the HMO Act of 1971. We went in the direction of establishing a for-profit healthcare system with the idea that if it's for-profit, they will provide better healthcare. Now, of course, there were those who just wanted more money, but I think there also were people like Richard Zeckhauser um, at Harvard who worked with Nixon and Carter. They were the people who they really thought this was the way to do it. We have for-profit car companies. Why shouldn't we have for-profit in healthcare companies? So back in 1970, the health insurance companies were all not-for-profit. The hospitals were all not-for-profit, all tightly regulated. And we did away with all those so that they could go out there and be innovative and search out efficiency. And the result has been they've searched out a lot of efficiency to screen patients, to find exciting ways to reduce care, and to make profit by making life worse for average Americans.
And I just want to say that every part of the system is profit seeking. So it's not just the insurance companies. The prescription drug companies are profit seeking. The hospital systems are consolidating so that they can figure out how to profit seek. And they profit seek within their own system. So, the 6 minutes with the person, that's a profit seeking. That's not a healthcare decision. That's a profit seeking decision by healthcare executives to try to force doctors into being like Starbucks, baristas for health insurance, right? So just to push to get people to move in quickly. So it's not about your care; it's about how much generating profit that doctor is making for the system. And so this whole system is geared towards figuring out how to steal money from you that should be going to actually making you healthier. And so the reason for single payer is not just that insurance companies serve literally no purpose, but which they do, but also that it would force decisions from the only thing big enough to force hospitals and all these things to actually work on care for us. And one of the things that's interesting to me is to see the Labour government and the Conservative government in England force its country into our system and having worse outcomes for its population. We're seeing in real time in the UK what happened to a system which is dismantling and becoming more American, and how much that's actually affecting people's real-time health. So we're also seeing, you can see what happens when you sort of take it, and they're still way better than us. Just to be clear, they're still paying less than us. They're still less rich than us and getting much better care and everything else. But there is just not, there's not a metric. You literally can't find a metric that doesn't say that this system is failing. Everything about it is failing. And so that's what I think is so frustrating for those of us who are serious about solving this issue of just trying to keep people healthy, that that our legislators won't even consider seriously a rethink of this system, which was created in 1995 to be in the platform for Bob Dole by the people who brought you Project 2025. These same people this is their system they've envisioned. This is their dream come true. The Project 2025 people, the people who brought you that, have brought you this system. And it's just shameful and frustrating that both parties have bought into the corporate executives' lies about this as the best we can dream of and the best that we can hope for. Because it's just ridiculous. Nothing about this is working. For anybody, for the workers, for the nurses, for the doctors, for us, nobody. Sorry.
Anna, all of this discussion of let's say good or bad uses of money reminds me of a good use for people's money.
Jonathan, you're so good about this. There's a link below. You can donate to the show. I should come up with a little rap so I can say it all, in rhyme and everything. But yeah, we'll take your co-pays. We're thinking of we'll do a system where people have to pass premiums.
Exactly.
We'll have co-pays for every episode and all that. We won't do that to you. We'll never do that.
Think of a recurring donation as a premium you feel good about paying.
That's right. Exactly.
Yes, I love that. Nowhere else are you getting this discussion.
Nowhere else are you getting this discussion. And so we would love, Gerald, if you can wrap us up by just telling us what can people do to support the legislation here in Massachusetts?
Oh, well, the best thing you can do is contact your legislator and urge them to support the mass care legislation. They can also reach out to Mass Care. I believe it's masscare.org. And from there, you can get lots of suggestions on ways to help organize with your community, and donate money.
Mhm.
Thank you so much. I'm going to do last minute words. We got any last statements from the peanut gallery? Jordan, I think you said your piece, man. That was beautiful.
I feel like my main thing, going back to my previous point, is like the need for us to have like a better political imagination of even so much as just looking at what happens in other countries. One, when the point about like comparing us to other places in the OECD, one of my talking points lately is that Massachusetts has a higher GDP than Sweden, but we have a much worse welfare state, and we should think about why.
Yep. My final word is just
Yeah.
honestly, I think it is a disgrace that in Massachusetts, where we have like 90% Democrats in the Senate and 80 or 85% Democrats in the House, and it's on the platform, the Democratic Party platform, year after year after year to do universal health care. It is a disgrace that the history of healthcare, universal health care legislation in Massachusetts is a disgrace. Sorry. And then I didn't know like that.
Happy note.
We all
Absolutely
agree.
agree.
It's a total disgrace.
Yeah.
It's a disgrace.
No, it's the thing I would underscore with that is when people see a platform, they typically understand a platform to mean what a party in power will actually want to achieve. And
Yep.
I think that speaks to such a disconnect that exists between, let's say, like a party base and the party electeds, where a party base clearly wants the electeds to achieve something, and the party electeds never care.
Yeah,
100.
and yeah.
Well, we know what should be done.
Yep.
The question is politics, not economics, and not healthcare policy.
Well said.
Amen.
All right. Thank you so much to everyone listening. Pass this along to your friends. Donate to the show, and we will see you all again next week.
Thank you.
Thank you.
Bye-bye.
Hey there. Thanks so much for watching us on YouTube. Please like and subscribe. And it would be amazing if you would also subscribe to us on your favorite podcast player. Just look for Incorruptible Massachusetts wherever you listen to podcasts. Thanks so much.